Are you thinking of owning your own cash-only OB-GYN practice? Or maybe adding cash-only services to your practice? Before you sign a lease or hire your first staff member, there are a few key choices that will make or break your success. In this video, I'm going to walk you through exactly what every successful cash-only practice needs to know, from how to set it up to keeping it profitable and how to scale when you're ready. So let's just talk about the big question. Is a private practice for you? OB-GYN practices can absolutely be profitable, but they're also demanding. You're not just a doctor, you're a business owner. That means you decide how you want your practice to run and what you do. But you're also responsible for running the show and managing people. Now, there are some pros and cons, so let's talk about them. On the upside, you're going to have flexibility in your schedule, more control over your income potential, and a chance to build the kind of patient experience you believe in. On the downside, you're taking a lot more risks. You're responsible for overhead costs. You're going to wear a lot of hats in the beginning. One of the most important things I like to ask my doctor, why do you want to start your own practice? Why do you want to be on your own? This is exactly the thing you're going to have to remember when things start getting tough. You go back to your why. Another thing to think about is your practice model. You can be completely solo and go completely on your own and start from the ground up, or you can even buy out somebody else's practice. Or maybe you want to go into a group model. Or maybe you want to join forces with another physician and not partner with them, but just share the space and share overhead. These are all options. The right choice is going to depend on your goals, your tolerance of risk, and how much independence you really want. Let's get into the nuts and bolts of how to start your own cash-based OB-GYN practice. The first step is going to be to choose the right legal structure. So whether you want to be a professional corporation like a PLLC or maybe an LLC or an S-Corp, the decision is going to impact your taxes, your liability, how you pay yourself, and it's really worth getting advice from either your CPA or a lawyer. Now, because you're cash only, you're not going to have to go through the traditional credentialing process with insurances, which is a huge time saver and money saver. If you're still going to operate at a hospital, they will do the credentialing for you with their team. Now, you still need to get your own MPI number and all the other licenses that are required by your state, so check those out and make sure you know what you're supposed to be doing. And don't forget about medical malpractice insurance. Even though you're avoiding dealing with insurances, you still need a strong med mal insurance. So you need to get one that covers your OB-GYN practice. Now, every state has their own compliance requirements, especially around women's health. Things like consent law, pregnancy-related regulations, HIPAA, and so many other things. Cash pay doesn't exempt you from those rules, so make sure you're up to date and in compliance for all those things. And when it comes to a cash-only OB-GYN practice, location matters. So start with knowing your target market. Are you going to aim for an area with a higher income where your patients really value convenience? Or maybe look at a community where families are looking for more personalized care? Or even an area where patients prefer to pay cash over getting insurance? Next, you're going to think about your referral network. Being near a hospital or a birth center or midwives, or maybe another women's provider can help you build relationships and keep a steady flow of patients. And don't overlook the building itself. You'll want to make sure you have plenty of parking, easy access for patients. It needs to be clean and high-end looking, and the space needs to offer privacy and comfort. And make sure zoning regulations allow for a medical practice. And make sure your space can be outfitted with the equipment that you'll need for your practice without any major headaches. The right location balances your patient base, your visibility, and your long-term growth potential. One of the biggest decisions you're going to make early on is which high-end services you want to offer in your cash-only practice. Do you want to focus on mainly gynecology and wellness, or are you going to offer prenatal care, maybe deliveries and procedures, and maybe you even want to add more lasers and aesthetic-type services? Your menu of services is going to drive everything else, especially your startup costs. On average, you're going to expect to invest anywhere from $250,000 to $500,000 to get up and running. And again, this depends on how comprehensive your services are going to be. And also remember, this doesn't even cover the cost of the salary you need to pay yourself. Some important equipment for an OB-GYN's office is going to be an ultrasound machine, colposcope, autoclave for sterilization, solid EMR system, maybe a fetal monitor. I mean, you know what you need, right? Make a list. And here's another key decision. Do you go new or do you go used? New can come with warranties and support, but it's a lot more expensive usually. Used can save you a significant amount of money, but you'll want to make sure that you're very selective in making sure it's safe, reliable, and still has a lot of years left on it. You can even think about getting refurbished equipment. And a lot of times companies will back those up with warranties. Now here's where the cash-only model makes the biggest difference. Because you set your own pricing, you can create packages that bundle services together. For example, a prenatal package that might include all the visits, ultrasound, lab work for one set price. Or maybe a women's health package that offers labs, provider visits, supplements, and maybe a laser. Bundles like these make your services more attractive and makes you stand out from the other OB-GYNs that are nearby. The bottom line, let your service mix guide your equipment and design cash-based packages that both cover your startup investment and make your practice unique in the market. Now let's talk about staffing. It's one of the most important things to build a smooth-running, cash-only OB-GYN practice. When you're just getting started, keep it simple. Your first hire should be a strong front desk person and a really good MA. These two roles will help keep your practice running smoothly, your patients cared for, and your schedule under control. And you might also looking at hiring a part-time biller or maybe a company that can do your billing. As you grow, add-ons like a nurse or maybe an office manager can take work off your plate and free up more time. Now here's the key. In a cash-only practice, the quality of your staff matters even more than your title. You need people who are friendly and welcoming, efficient, empathetic, and most importantly, you want them to be able to think on their own without you having to micromanage everything that they do. A practice like this will thrive on patient experience, and your team is a huge part of that. Your goal is to build a lean but capable team that reflects high touch points, patient-centered experience that cash-only practices are known for. Now let's talk a little more about patient experience. In a cash-only practice, your patients are paying out of pocket. This means they expect to be treated like a VIP. They want convenience, attention, and a level of care that feels very personalized. And here's the reality. These patients will talk. If their experience is great, they're going to tell everybody. And if their experience is bad, they're still going to tell everybody. And these kind of referrals are going to be the backbone to your cash-only practice. So how do you deliver this kind of experience? Well, start with an intake process that's easy and gets patients scheduled quickly. From the very first phone call or text or online form, you want to make it very simple and clear and get these patients scheduled quickly. Next, use scheduling software with automated text and email reminders. Patients appreciate that ease, and your staff, it'll save them some time. And follow-up is crucial. Again, cash-only patients like special attention. So a quick check-in call or a message after a procedure will go a really long way with them. And finally, think about OB-GYN's specific patient flow. Emergencies happen, urgent visits, and deliveries can really throw off your schedule. So have a system in place, like backup coverage or block time in your calendar to keep these experiences smooth for all your patients. The bottom line is that when you create systems that make your patients feel valued and cared for, you're not just delivering medicine, you're building loyalty and long-term growth. Next up, let's talk about how patients actually get into your cash-only practice. First, you need to build a referral network with other private practice providers. Think primary care physicians, midwives, and maybe pediatricians. They see women every day that need your services. Next, focus on community outreach. Maybe think healthcare fairs, prenatal classes, or info sessions on women's health. And finally, have a professional website done that makes booking easy, calling you easy, and figuring out where your location is. You also need to make sure you clearly have what services you offer on this website. Patients will check this before they even call you. Starting a cash-only OB-GYN practice is not easy, but with the right plan, it can be both meaningful and profitable. Remember, opening the doors is just the first step. Long-term success comes from keeping patients coming back and building loyalty. So if you're ready for the next step, check out my next video on how to increase your patient referrals. It's full of practical strategies that you can start doing right away. And don't forget, we offer a checklist on how to do everything to open your practice. You can find it by clicking the link in the description. Thanks for watching, and I'll see you in the next video.